there was a significant problem with infections with bacteria that were resistant to a lot of antibiotics before the war, but the war has really supercharged that problem.
Проблема існує і, на жаль, але війна точно також впливає на те, що ця проблема стає все більш широкою в Україні і за кордоном точно також.
We've seen people in our facility with tremendously high rates, some completely drug resistant, so no antibiotic that can treat the infection that they have.
They can't get people out fast, and that has huge consequences for survival.
This front is incredibly difficult to deal with Ukrainian wounded. A lot of the areas that we're seeing Ukrainian soldiers wounded are in really hot areas.
Ukrainian society bears an unforgiving toll without adequate means to cope. Over 10% of adults are estimated to have moderate or severe mental health disorders, yet care is very, very limited. The number of soldiers killed and wounded, reportedly during the recent counteroffensive, have skyrocketed. Over 80% of those wounded have been infected with highly resistant bacteria that are shortening the lives of soldiers. The war in Ukraine has dramatically expanded the threat of antimicrobial resistance, AMR, and the path out remains very unclear.
The numbers that we have are pretty remarkable. The resistance rates are 75–80% for some of the worst pathogens, the worst species that we see. And by worst, I mean the ones that cause the most morbidity and mortality in humans. I believe those numbers are rather underreported.
So it's causing a big problem in terms of suffering among the patients that are infected and threatening other patients because these organisms can spread in hospital environments.
It is the same pattern seen in the wars in Afghanistan, Iraq, and Syria, where there was inadequate detection and data systems, slow movement of the wounded off the battlefield to care, and very weak management in the delivery of antibiotics.
Перше, напевно, я би хотів ще раз підкреслити, що проблема АМРу – це є проблемою глобального здоров'я. І, безумовно, в умовах війни знайти баланс між обмеженням допуску до антибіотиків або обмеження використання і користю від застосування антибіотиків – це дуже складний баланс. І, насправді, для деяких територій цей баланс буде постійно змінюватися, тому це дуже складне завдання для уряду балансувати між цими політичними рішеннями.
The US military learned in Iraq and Afghanistan how to manage effectively the threats of AMR. Yet in the case of Ukraine, the US military chose to limit its contributions to what it could do outside of Ukraine. That was because a decision was taken by the White House that to go inside was to risk escalation with Russia. At the same time, NATO did not make AMR a priority. In retrospect, these decisions were serious mistakes.
There is no substitute for the US military with its vast experience in Iraq, Afghanistan, and other countries with active combat to provide medical evacuation quickly, to forward deploy doctors to deal with wounded, those that have been shot, those that have stepped on mines. There's no substitute for that kind of battlefield experience.
Ukrainians have been paying a heavy price since Russia invaded their country last year. Thousands have lost arms and legs, and that has created an urgent need for artificial limbs.
Over 20,000 combatants have lost limbs and await prostheses.
The wounds often require very significant rehabilitation after surgery, and the capacity of Ukraine, like most other countries, to provide rehabilitation at that level is very scarce.
Increasing uncertainty and division surround US policy towards Ukraine. In the third year of Ukraine's war, the United States should nonetheless remain steadfast. The United States and its allies should commit at a higher level to assist, to work in partnership with Ukraine to address the mental health gaps and to address the rehabilitation gaps. The United States should also commit at a higher level to work on the ground inside Ukraine in partnership with Ukrainians to combat AMR. Over the long term, decontaminating the health system in Ukraine and building a system of effective prevention and control of AMR is a long-term enterprise that requires a long-term commitment by the Ukrainians and its partners, including the United States.